Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, February the 17th, 2021. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, Brad, good afternoon and thank you. Today, Dr. Davila will be detailing her professional public health advice, which has been provided to the province, recommending extending the lockdown in Toronto for an additional 2 weeks. This is based on public health's significant concern around the new COVID-19 variants that we are starting to see in settings across our city. Confirmed cases of the variants have turned up in long-term care, hospitals, one shelter, and in a meatpacking plant, for some examples. I have repeatedly said that our priority must be the safe reopening of the schools and keeping them open safely. This just began in Toronto this week, and we should focus on that in the short term while we monitor the broader impact of the variants. Public health has been clear that a safe reopening of schools and careful monitoring of the variants will require some time. I know extending the lockdown will cause continuing hurt for many businesses. But I also know that we have followed the public health advice throughout this pandemic so that we can keep as many people healthy as possible, so that we can save as many lives as we possibly can. That approach allowed us to beat the first wave and to flatten the curve. And while there have been far too many tragedies, we have protected our healthcare system and we have avoided the worst-case scenarios predicted in earlier modeling. Scenarios that we have seen in real life in other jurisdictions around the world. We want to do everything we can to avoid that, and I believe that what Dr. Davila is recommending is a step in that direction. Despite the huge dislocation the pandemic has caused for people and for businesses, the worst mistake we could make right now is to ignore the advice of our medical experts and begin to reopen too quickly. We absolutely do not want to find ourselves opening things up, even slightly, and then having to close down again just a few weeks from now. With the promise of vaccinations upon us, we need to ensure that this lockdown that we're presently in is the last one. We can do that by not reopening too quickly and letting the variants get out of control, by continuing to follow other public health advice, wearing a mask, keeping our distance, staying at home as much as possible, and being ready to roll out those vaccines as soon as the federal and provincial governments can provide additional supply. I support Dr. Davila's recommendations for the City of Toronto because I believe we have to do everything we can to avoid a third wave. A wave that would hit us just as restaurants would be opening patios for outdoor dining in May, just as more and more residents will be eager to get outside and enjoy warmer weather, and just after the rescheduled March break and after Easter. I am not a doctor or a scientist. I do have a responsibility, however, to get the best medical and scientific advice that we can get, and we have done that. I am supporting Dr. Davila's recommendations of a slower reopening because, after much consultation and many questions asked of her, including in particular by me, I believe this is the right thing to do. We have many more questions than answers about the variants. When you have more questions than answers, that is a time to exercise great caution. I believe the action to be taken today, or the action being recommended today, will save lives, will protect the healthcare system, and will protect people's health, and will, in just a very few weeks, allow Toronto to begin to reopen safely and to stay open. On that note, I will ask Dr. Davila to provide her report for today.
Thank you, Mayor Tory, and good afternoon. Today, I am reporting 302 new cases of COVID-19. 13 people have been admitted to hospital, bringing the total to 378, and 87 people are in the ICU. Sadly, I am reporting 3 deaths. There are 56 confirmed variant of concern cases in Toronto. 54 are the UK variant B117, and 2 are Brazilian variants. I have never been as worried about the future as I am today. A week ago, there were 33 confirmed cases of COVID-19 variants in Toronto. Today, we have 56. In fact, there are more than 5 times that number being confirmed in the labs right now. 283 cases from Toronto that have screened positive as variants of concern. Lab work is underway to confirm these findings and clarify which variants. It's unlikely the cases will be confirmed as anything other than as variants of concern. The variants of concern mean we face a deceptively dangerous situation. Right now, the case count numbers don't look so bad. They don't sound bad. But today's variant count is the tip of an iceberg. By the time the confirmed case counts are big enough to shock us, it will be too late to do anything. We will be in a third wave, as bad as anything we've been through thus far. In Germany today, the Minister of Health said the proportion of the B117 variant there rose from just under 6% to more than 22% in 2 weeks, and that the proportion of cases with the variant are doubling every week. Newfoundland and Labrador, which has seen a total of just over 700 cases throughout the entire pandemic, suddenly has almost 300 cases on its hands linked to the UK variant. We now know that variant was starting to spread in the UK last September. It wasn't identified then, and so it simmered throughout the fall. In mid-November, daily cases in the UK were around 15,000 per day. By mid-December, they skyrocketed to peak above 50,000 per day. That is what happens with exponential growth. And exponential growth is what Toronto faces. Suddenly, case counts leap, and the opportunity to prevent it is gone. So I have written to Ontario's Chief Medical Officer of Health, Dr. David Williams, asking that the province delay assessing Toronto's return to the COVID-19 response framework until at least March the 9th. I've written this letter jointly with Dr. Lawrence Lowe, the Medical Officer of Health for Peel Region, who seeks the same delay for his region. There are 345 cases of confirmed variant in Ontario. A week ago, Ontario's Science Advisory and Modelling Consensus Tables advised that the highly transmissible B117 variant is spreading and that cases will likely grow again in late February, with ICU occupancy following about 2 weeks later. It is said that variants are likely between 5% and 10% of cases now, and that B117 will soon dominate here in Ontario. The declining cases of COVID-19 here in Toronto isn't a result of luck. They follow after the state of emergency and stay-at-home order. While there is a downward trend in many key indicators, warning lights are flashing too. Weekly incidence rates are declining, but hover at approximately 100 per 100,000 population in both Peel and Toronto. Toronto hospitals still face pressures in emergency rooms, acute care beds, and staffing. Mobility data show that people in Toronto are starting to spend more time out of home again, raising the inevitability of increased spread. Variants of concern are now present in most congregate settings in Toronto. But here's the good news. This is really important, and I agree with the observation of the Provincial Science Table. Public health measures appear to be effective against variants, as are aggressive vaccination and sticking with stay-at-home orders. In the UK, lockdown measures have brought the cases down again. By late January, the country was back to just above 30,000 cases per day as the national lockdown continued. Still double the levels in November, but down significantly from the highs the month before. The UK has not yet decided on when its lockdown will end or how the lifting of the lockdown will be phased. As a public health physician, I've never been as concerned about the threat of COVID-19 to your health as I am now. Not at any other point in the pandemic. I am obligated to make it that clear. I would love to be able to tell you that we are at a point where restrictions can substantially lift. I look forward to that day. Today, it is better to delay reopening and stage reopening gradually when we have certainty that the time is right. Better to wait until we know more than to put everyone through the yo-yo of opening, closing, reopening, and closing again and again. With that, I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila. Good afternoon. Before I provide my update on our immunization task force operations, I would like to extend my sincere condolences to the family, friends, and all those impacted by this morning's tragic and fatal fire in Orphans Green Park, located at Adelaide and Power Street. At approximately 6 o'clock this morning, our crews responded to a fire involving a wooden structure in Orphans Green Park. Unfortunately, during the course of fighting this fire, one male occupant was located inside the remains of this small wooden structure. Sadly, he was pronounced dead at the scene. The investigation into where this fire started, the cause of the fire, and the circumstances contributing to this tragic loss of life is now underway, in collaboration between Toronto Fire Services, Toronto Police Services, the Ontario Office of the Fire Marshal, and the Office of the Chief Coroner. On behalf of all of us, I extend my heartfelt condolences to everyone impacted and affected by this tragic loss. On Monday and Tuesday of this week, the city-operated proof-of-concept COVID-19 immunization clinic located inside the Metro Toronto Convention Centre reopened in order to deliver second doses of COVID-19 vaccine. The same group of healthcare workers who received their first dose of vaccine during the initial 2 days of clinic operations in January received their second doses this week and are now immunized against COVID-19. I'm very pleased to report that the clinic operated smoothly and that there were no issues identified during these 2 days of second dose vaccination operations. I'm also pleased to report that the Provincial COVAX On software system, which is the system used to track and manage all COVID-19 immunization operations in Toronto, also worked very well, with no operational issues being reported by our team. Our immunization task force continues to be hard at work, preparing our network of city-operated immunization clinic locations such that we are ready to go when the time comes. We do not yet have confirmation from the Province of Ontario as to when we will be able to resume COVID-19 immunization clinic operations. However, our teams will be ready to go when vaccine availability permits the resumption and expansion of immunization operations. We will ensure that the details relating to the ongoing rollout of the COVID-19 immunization efforts in Toronto are well communicated across each of our communications networks and platforms as very soon as new information becomes available. Please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunization operations in our city. Thank you.
Thank you, Chief. Before we go to questions, just a reminder that you will need to unmute yourself, and we'll go first now to Brian Passafium from the Toronto Sun. Go ahead, Brian.
Yeah, good afternoon, everybody. Good afternoon. First question's for the mayor. Yesterday, you issued a statement praising the changes made by the federal government that empower municipalities to enact handgun bans. I spent some time today looking at Toronto Police's seized firearms Twitter feed, and noticed out of the 23 firearms posted so far this year, 20 of which were handguns, all but one of them are prohibited weapons. A quick scan of the firearms they tweeted throughout last year also suggests that police are, for the most part, finding that Toronto's criminals are armed with weapons illegal for any law-abiding Canadian to own. My question is, what's the point of prohibiting legal handgun ownership in Toronto when the vast majority of crime guns aren't even legal to own?
Well, you can take statistics from any point in time and see that they reach one conclusion or another. I have always been consistent in my support of more gun control in the City of Toronto, and for that matter, I've been very consistent, as has the City Council, in calling for a national handgun ban. Right now, we're taking a look at this legislation that was brought forward, which amounts to less than a national handgun ban, and seeing what the implications will be for the City of Toronto in terms of both the practicalities and in terms of whatever role the province may or may not have to play, and we haven't had a chance to complete that analysis as yet. But I am heartened by the fact that the federal government is taking some steps in a number of areas to do with greater gun control, including at the border. I'm heartened by the fact they're going to make a commitment, or they've made a commitment to invest more in young people. I think there are some more changes they can make in the legal system, including on bail and sentencing and some areas like that. But we just have to move forward and make progress as best we can as a city and as a country. And I will be trying to show leadership in making sure the city does whatever it can to stop the prevalence of handguns in our city. I ask myself the question all the time. I keep asking it to myself and to others. Why would anybody living in the City of Toronto need to have a handgun? And I can't think of a single answer as to why they should, other than police officers and very limited exceptions.
Thanks for your response. It doesn't really answer my question, though, about like how prohibiting gun ownership will stem the tide of guns in the street that aren't even legal for Canadians to own.
Well, look, the fact of the matter is that legally owned guns have, on a regular basis, and I'm not suggesting for a moment it's the majority, on a regular basis found their way into the hands of criminals and have been used in the commission of criminal offenses. So that's why I say you can look at statistics over different periods of time. To me, anything that reduces the number of guns in circulation in the City of Toronto and puts laws in place that do that, and for that matter, I would prefer it be across the country when it comes to handguns, is a good thing, because it is just going to mean less guns to fall into the wrong hands to do the wrong things with them. And I just think that it is one of many areas of life where, unfortunately, because of the activities of a few, the rights of others have to be affected by that. But I just think that gun control, together with investment in kids and families, support for the police, and changes to some of the laws like bail, where you have revolving doors, in some cases, are things that we need to do to stop the gun violence that I think people are, wanting to see some action on.
Brian, I understand that was a clarification to your first question, so I will give you one more. Go ahead.
Okay, thanks. My second question is about Cafe TO. The fear over this new fear over the variants and extending the lockdown until March 19th. Where does that put the city's plans to resume Cafe TO this spring?
Well, if you look at the math on this, as it were, in terms of the time periods involved, We've started accepting applications for the Cafe TO program now. Those applications have to be considered. We indicated that the earliest date at which they could be opened in any event would be in early May because of the need to clean up after the winter on the streets and because of the installation time and because of the end of the winter season in terms of snow plowing. So all of those were factors that would stop these cafes from being installed until the end of May. So I guess we all would want to have our fingers crossed that we do the right thing that the doctor has recommended in terms of being prudent about reopening, and it will still allow us to actually have Cafe TO patios open and not be in another lockdown by then, which is precisely what we're trying to avoid, is having an opening and then be back in a lockdown right at the time when those patios will be opening in May.
Thank you. We'll go next to Dave Woodward from Global News Radio. Go ahead, Dave.
Thanks, Brad. This question is for Dr. Davila. Premier Ford has said that local public health officers can leave their municipalities in lockdown and that he will back them fully if they so choose. So if you're worried about reopening, Dr. Davila, why don't you commit now to staying in a lockdown instead of just asking for one?
So, I admit that my expertise is more in public health medicine than it is around legislation and what's required in order to stay in different states. I will say this, however, we are having productive conversations with our provincial counterparts, specifically on this issue. I suspect that those conversations will continue over the next few days, and I hope they remain as productive as they have been over the last few, so that we can move forward. I think we all have the same idea in mind. I don't think there's any question that we all want what's best for the population, certainly of Toronto, and in the case of my provincial counterparts, I'm sure they're interested in securing the overall health of the population of the province. My sense is that, as you've heard the mayor say, the best way to do that is to not find ourselves in a cycle of opening and closing and reopening and closing again, but rather to, really address the situation we have in front of us, use the best available science to support, healthy people and therefore a healthy economy.
May I just add to that? We've had similar discussions ongoing at the elected representative level. I've talked to both the Minister of Health and the Premier in the last couple of days about this matter, and they've been productive, constructive discussions, and I hope that, as Dr. Davila said, they will lead to a productive and constructive place in terms of what the best advice is that we would have for the City of Toronto, which is the area of our responsibility.
My follow-up for Dr. Davila. What is your message to business owners in the City of Toronto who believe that the decision to stay in a lockdown shows a lack of trust in their abilities to keep their shops safe?
What I would say is that we all know that healthy businesses and a healthy economy depend on healthy people. And the measures that I'm calling for, the caution that I'm calling for, is all with that in mind. We're focusing on what it is that gives us the best circumstances to protect and promote the health of the residents of Toronto. That, in turn, will provide what's best in terms of healthy businesses and ultimately a healthy economy. What I can say is that what we've seen with the new variants of concern is that they do have heightened transmissibility. That's the current state of evidence. We've seen this in other jurisdictions, many, many other jurisdictions around the world, where these new variants of concern just transmit much better, much more readily from one person to the next. And unfortunately, there is increasing data that also shows that these new variants have more significant outcomes and more severe outcomes, particularly around death and mortality. So that's why I'm calling for these actions. It's ultimately about the health of people, and that in turn is necessary for healthy businesses and a healthy economy.
Dave, can I just say this? There seems to be this, and there has been throughout, this desire to sort of say that somebody's getting blamed for this, or that we're casting doubts on people's sense of responsibility to do the right thing. What, in fact, we've been trying to do, I think, and I'm not the doctor or the scientist, but I think I understand this, is we're trying to reduce the mobility and contact people have with each other. And there's evidence even in front of us now in this lockdown that you saw an improvement in people staying home and the phones staying in one place and the traffic levels being down. But to be frank, in the last week or so, those numbers have started to come back up, and that suggests that people are trying to are out being more active and in contact with one another. And so I would just say that it is not, I don't find it constructive for us to be saying that we're blaming shop owners for this or blaming restaurants for that. We're just trying to say to people that the best thing to do is to stay home, and we're trying to make sure that there are fewer places for them to go, and that's been consistent all the way through.
All right, thank you. We'll go next to Matt Bingley from Global News. Go ahead, Matt.
Hi, my question is for Dr. Davila. Just the fact that we sort of seem like we're back in a time loop here of, back in the fall, we seem to be having the exact same conversation of the province floating perhaps unrealistic dates for loosening restrictions. I'm just wondering how responsible you feel the province. I know the mayor just said that he doesn't feel like the blame game is the right way to go, but how do you feel about the position that you're being put in to have to make these decisions? And how responsible do you think the province is being by saying that we can simply avoid all this just by having people stay home? When at the same time they're loosening restrictions, or at least considering that?
Matt, I would say this. I agree with the mayor that the blame game isn't all that productive. I would say further that I think we're all frustrated with COVID-19 as a virus, and if there is something to blame, it's the virus. How do I feel about my job? I think it's really important, and I have I take my obligation to the people of Toronto incredibly seriously. I will do the best I can, as I do every single day, to protect and promote the health of the residents of this city. So I would say that blame is not part of that. My job is really to look at the data, to take the best available evidence that exists out there and apply it in a fashion that allows for the best in terms of the protection and the promotion of the health of the residents of this city. That's what I've done throughout the entire pandemic. And that's what I intend to do until we get ourselves through this, and we will get there.
And to follow up on those variant cases, you mentioned the fact that there are 5 times the number of reported cases that are currently pending, I guess, that secondary test. Can you just take us through where these variants are originating? I know there was that one big meat packing plant that you had an outbreak there, but can you tell us about the origin of these? Are these other clusters in apartment buildings and such?
So, Matt, what I can tell you is that we have seen cases of variants of concern in every congregate setting in Toronto in one way, shape, or form. And the reason why is because, exactly as the mayor said, COVID-19 spreads when people interact with each other. That's how the disease spreads from one person to the next. This is a disease that needs us to help it spread from one person to the next. So all the circumstances where you have interaction between people are the circumstances that give rise to the spread of COVID-19. And when we're talking about a variant of this virus that has more transmissibility, it just means that it's easier for that virus to spread from one person to the next and create infection in the next person. So that's why the recommendations now are to try to help people to limit the opportunities that they have to mix or interact with others other than the people with whom they live. That's why you hear us constantly talk about those self-protection measures, because they are about minimizing interaction to the greatest extent possible and protecting yourself where those moments of interaction simply cannot be avoided.
Okay, thank you. We'll go next to Jennifer Pagliaro from the Toronto Star. Go ahead, Jen.
Hey, everyone. I wanted to first ask Dr. Davila, I wanted to follow up on something Matt asked about, just in terms of feeling like we are in this time loop. Can you elaborate on when did you first make the request to the province to have the lockdown extended? And you mentioned a letter with Dr. Lowe. Can you just spell out to me why you feel you need now to write a letter, or is this your first attempt at asking them to do something about the lockdown?
So Jennifer, there is constant conversation, as I'm sure you can appreciate, that happens between us and our provincial counterparts. That's a necessity, and it's actually part of managing a pandemic such as the one in which we find ourselves. Dr. Lowe and I wrote a letter to the Chief Medical Officer of Health, Dr. David Williams. That letter was sent to him over the weekend in order to make it clear what we were feeling and what we saw as an appropriate course of action for our respective jurisdictions, given what we're seeing on the ground. Right? We're seeing increasing numbers with respect to variants of concern, and we've seen what variants of concern have done in other jurisdictions. We continue to see some challenges within our own respective jurisdictions around pressures on the healthcare system, exactly as I described in my remarks earlier this afternoon. Pressures on emergency rooms, pressures on acute care beds, pressures on staffing. And we really do want to make sure that we're preserving our healthcare system as much as possible, not just for COVID-19 patients, but for patients of all kinds. We know there are other medical conditions that need to continue to be managed. So these are the kinds of things we articulated in our letter. And of course, the final point that I think I would make is that there is real concern around making sure that we're not only watching variants of concern and doing the best we can to mitigate their spread, but also recognizing that schools have just reopened here in Toronto and in Peel as well. We'd like to make sure that we're doing the best we can to support the safest reopening possible for those schools and the resumption of in-person learning. So taken all together, we felt it was important to make sure that that was articulated in writing with our rationale for the request really spelled out very clearly for our provincial counterparts.
Jen, just before you go to your second question, that letter will be released publicly shortly.
Okay, great. And just to follow up on another topic, on the monitoring dashboard on the city's website, it shows in the red the city's contact tracing abilities. 12% of cases reached within 24 hours. I'm wondering what you see as the issue there. Does the city need resources help? Is that a request that's been made, or what's happening there?
So Jennifer, I'll have to look specifically at those numbers on our dashboard, but I can say this. Just recently, we transferred onto the provincial case and contact management system. This is a subject that I addressed at length, not last week, but the week before. That was a pretty significant undertaking on our part at Toronto Public Health. That transition is now largely behind us, and my understanding is that our numbers are much, much better in respect of our follow-up with both cases and contacts at this stage in time.
Thank you. We'll go next to Denise Peglinawan from the Canadian Press. Denise, go ahead, please.
Hi, my question is for Dr. Davila. Just to clarify, do you want the regional opening moved to March 9th, or will you still be assessing the reopening date?
So the suggestion in the letter is that we defer the reassessment until that time, in order that we have the opportunity to establish that things are going as safely as possible and as well as possible with the return to in-person learning at schools, and as well to have that opportunity to make sure that we're doing the best we can to reduce spread of COVID-19, particularly in light of variants of concern. You know, just last week, the provincial science table provided a presentation, courtesy of Dr. Staney Brown, talking about what the modeling projected for variants of concern. And really calling for the need to reduce mobility, to reduce interactions between people so as to limit the spread of COVID-19. I think waiting until March the 9th to reassess, what our situation is and to make decisions on a go-forward basis is a cautious and wise approach, given what we know of our current circumstances.
Thank you, Doctor. And my next question is for Mayor Tory. A colleague of mine wants to ask, what is your plan with the news of the fire at the encampment site? What is your plan to make housing more affordable? So people don't have to live outdoors?
Well, I will ask Marianne Bedard to comment as just in terms of some of the specific initiatives that we're undertaking, but I should start by saying anytime anything like this happens, it's a tragedy. This kind of thing, you spend all of your effort, and all of our city staff work so hard, including our Streets to Homes team, to provide the maximum amount of support for people that we can, and that involves dozens and dozens and dozens of encounters with people who are sleeping outside and who are sleeping on the streets to try and convince them to accept help from us, which we're sometimes successful at doing and sometimes not. But it's a tragedy any which way you look at it. We are presently embarked with huge help from the federal government in particular on a program to have in place by the end of this year hundreds of supportive housing units that were not in place at the beginning of the year. We are in a situation where we have thousands of affordable housing units in the pipeline now, some under construction, some almost ready for occupancy, that we didn't have 2 years ago. So we have this as the top issue after the pandemic, I would say, in the entire city. And the entire objective is to take people who are presently underhoused, including in particular those with special needs, needs that have to do with mental illness or with substance use or other things like that, and to house them in a supportive environment. And so I would just say we're going to continue on, and our efforts in that regard are unrelenting. They do involve partnership with the other governments, and they are aimed specifically and first at having people come off the streets, out of encampments, into supportive housing and into affordable housing. And they are many times the kind of effort that was being made, prior to, frankly, my being here as mayor and prior to this administration. But there are works in process in all of them, but we're making substantial progress with the help of the other governments. And we need help now from the province in terms of some of the operating funding for that supportive housing so that we can have alternatives. But one last thing I should say, we have throughout this year and before this year had a Streets to Homes program that has been successful at rehousing in permanent housing literally hundreds of people who are encountered when they go out to check. And what we need to do now is just make sure the supply of supportive and affordable housing is there such that we can rehouse hundreds more and not have anybody living on the streets. And on that note, perhaps I'll ask Marianne just if she wants to talk a little bit about some of the specifics we're doing to help people who are in these circumstances. Thank you.
Marianne, go ahead, please.
Yes, thank you, Mr. Mayor. A great summary of the efforts that the city has undertaken. The issues of homelessness are always very complicated, especially the issues of people who stay in encampments. I think it is important to note that last night our Streets to Homes teams were out all night long. They had 73 interactions with people who were staying outside. 10 of those people accepted assistance. They were on site at that encampment at about 2:30 this morning, attempting to engage with the people who were staying there. Unfortunately, they were not able to get a response, even though they were offering support to come inside, as well as access to blankets and sleeping bags if they wanted to remain outside. We had space in the shelter system last night, and it is always our hope that people will accept the opportunity to come inside. And in fact, we have been able to assist more than 1,300 people move from encampments into safer indoor placements since the beginning of the pandemic. And since then, 70 of those people have actually moved into permanent housing, which is obviously our end goal. Also, since the beginning of the pandemic, we have been able to permanently house more than 3,200 people from the shelter system, including those from the encampments. This is done with key support from our community agencies who support people once they've moved into permanent housing. Our partners in TCHC that have been actively working with us to identify units within their portfolio. But more immediately, this month, we have identified 2 additional hotel programs that will be opening. This will bring an additional 300 rooms available, and both of those sites are in the downtown core. We are also opening up almost 200 permanent housing opportunities as well for people who will access housing through the shelter system. I think there's been considerable amount of work done, both in our emergency response to COVID and layering in a very important focus on permanent housing. I think we're probably got the most comprehensive response in Canada, and I'm very proud of the work that our team has been doing.
Thank you very much, Marianne. We'll go next to Lorenda Redicott from CBC News. Go ahead, Lorenda.
Hi there. Thanks, Brad. How much of a heightened concern is there now in shelters given these variants of concern? And can you clarify whether any of those 283 that screened positive for a variant are any of those in shelters? And if so, how many?
We will start with Dr. Davila.
Sure. So thanks, Lorenda, I should say. I don't have the exact figures with me. I do know that there are some screen positive variant of concern cases within the context of our shelters here in the city. And obviously, these are always concerning. Any congregate setting where you have a virus like COVID-19, and particularly a variant of COVID-19 that has demonstrated increased transmissibility, is of concern. I can tell you that the team at Toronto Public Health is constantly working with our colleagues in the Shelter Support and Housing Administration in any shelter setting where there is a COVID-19 case, variant or otherwise. And so we continue on with that work, and we apply, again, the best available knowledge that we have, the best available evidence to reduce transmission and protect the health of those who are resident within those settings and who work within those settings.
Follow-up, Lorenda?
Yeah, I understand. This would probably be for Marianne Bedard. You mentioned that there was space in shelters last night. I understand that sometimes when advocates for the homeless are calling the city, while these numbers may show up that, that there are perhaps dozens of spaces available, that it's not actually the case. So could you explain that disconnect and what's happening there?
Certainly. So access to the shelter system is done through our central intake system. And I'm sure you can imagine how dynamic a shelter system that has over 6,000 spaces is. People are moving in and out of spaces 24 hours a day. And in between those moves, those spaces need to be taken offline for a short period of time so that they can be sanitized. And we can make sure all of the public health protocols are being put into place. So when somebody calls looking for a shelter or a respite or a warming space, they talk to somebody at our central intake line. They determine what their needs and preferences are, identifying if they need a specialized program, and then they look for availability. There may not be any availability at that specific time, and so people are asked to either call back or they're asked if they would like to receive a call back when space becomes available. And that is our process. So as we identify that a space is available, we would call somebody back and make that available. But it is a very dynamic system, and sometimes we are not able to offer people the space that they feel they're able to accept, or at a time that they're able to accept.
Okay, thank you again, Marianne. We'll go next, and final question to Dave Ryder from the Toronto Star. Dave, go ahead.
Hi, everybody. Mayor Tory mentioned indications that people are starting to move around or leave home more. Can anyone elaborate on what data that comes from, the time period covered, and how much more movement you're seeing?
Well, I was making sort of top-line reference to that, but if you look even at the graph that sort of charts the mobility of phones, which is some data that's received by Toronto Public Health on a regular basis, it shows yes, some definite improvement. It shows a very low level of activity last spring where people's phones were staying in one place, one assumes home because most people were staying home. It then shows, as you'd expect, an increasing level of activity and mobility all through the summer and into the fall. And then it shows a slowly diminishing level of activity, but never back down to the levels of last spring, even during this lockdown that we're in now. And then more recently, it showed a slight uptick back up in the direction of people moving around more. And you know, who knows what the explanation for that is, but it shouldn't have been the case, given that the fact is the lockdown, the stay-at-home order, and all those measures have remained in place throughout that period, say from Boxing Day until now. Similarly, with the city's traffic levels, you see levels that were way down last spring that came back up, as you'd expect, over the course of the summer, and then have dipped down a little bit in recent times, but have not dipped down anywhere near to the levels that were the case last spring. And so, and I think, in fact, again, with the traffic levels, again, there's been a slight uptick in the last recent period of time. And this could have any number of explanations, but I suspect it has mostly just to do with the fact that people either get fatigued or forget or have other things that they need to do in their lives. I understand all that. God knows we need people to have good news in their lives, and they're looking for some. But those are some of the facts that we see, which are only indications that people are moving around, certainly more than the ideal circumstance, which would have them still, wherever possible, if they're not essential workers, staying at home and not going anywhere except for the noted exceptions like some exercise and so on done with members of your own household.
Thank you. And the follow-up, I think, is for Chief Pegg, unless anybody else wants to handle it. And that's, we're hearing federally that the great vaccine drought of 2021 is either over or almost over. I'm wondering, given the concern about the rise in variants and the hope that immunization might help combat that problem, is there any word at all when immunizations will resume in Toronto in any significant way?
At this point in time, at least what has been communicated to me, unfortunately there is not. We are in daily contact with General Hillier and the Provincial Vaccine Distribution Task Force, and as of this point in time, we have not received confirmation from the province as to when we will be able to open any or all of the city-operated immunization clinics, nor have we received any confirmed indication as to when we will start to see a significantly increased flow of vaccine into the City of Toronto, of course, coming from the province. So we're eagerly awaiting that information, but we are all, of course, dependent upon the supply chain coming from the federal government through the provincial government and into the City of Toronto. So as we've said before, our commitment is that we are well underway and we will be ready at the point in time when vaccine can be made available. But at this point in time, unfortunately, no, we don't have an indication as to when that will be.
Thank you, Chief. That concludes today's briefing. Just a reminder that the news release on today's briefing will be going out very shortly, and attached will be the letter referenced to Dr. Williams. Please stay well, everybody. We'll be back again next Monday. Thank you.